Unfortunately, for far too long, an individual's income was not keeping up with the increase in rent. Now you add the layer of a pandemic health crisis, that's only exacerbating this connection.
The less your income, the more difficult it is to find an affordable unit to your budget, and the more difficult it is for developers to build a unit that's affordable for you.
Look at the parcels, identify the ones that are in opportune areas next to healthcare, next to education, next to food, next to all the things that make a community a vital place to live, and then put those RFPs out to redevelop a housing component.
I'm just really excited about the fact that we're seeing all these different levels of government, federal, state, and local, the business community, the philanthropic community, they're all coming together to address the issue of affordable housing because there's clear impacts.
Hey everybody, welcome back to the Vitalyst Spark podcast. I'm your host, John Ford. Our commitment to you with this podcast is to spark innovative thinking about well-being and keep the community health conversation growing. And then COVID-19 came along, which has not only flipped daily life on its ear, it has also exacerbated big challenges that Vitalyst and its partners have been working to solve. Not sure what we mean by big challenges? Well, look no further than the issue of available, safe, and affordable housing. Throughout Arizona, supportive shelter was increasingly out of reach for far too many residents BC. That's before COVID. Now, things are far more challenging and urgent. No one yet knows the exact increase in the numbers of Arizonans experiencing homelessness, in need of supportive housing, or hoping to not have to choose between, say, rent and food or rent and filling a prescription. But it's fair to assume that COVID-19 hasn't made the lack of affordable housing any less of a crisis unto itself. Many experienced healthcare and government partners agree. Housing is healthcare. In fact, there's another curve out there to flatten. The spike in the numbers of people for whom shelter in place is impossible, for whom the concept of a supportive home is a challenge, at the least, or even worse, a high-cost, high-stress, overwhelming burden. Here's the thing. There is opportunity in crisis. Very smart, very dedicated people have been working on housing all over the state, so we asked some of them to join us today. We all need to know what tools we might use to make positive progress when it comes to ensuring that everyone can find a place they can call home. So let's get to it. It's time to talk about the people, the ideas, and the municipal, state, and federal options for action that can create more affordable housing in the new era of COVID-19. We have three amazing people in the room today to talk to you about what's going on with housing here in Arizona and specifically in the city of Phoenix. We have with us Joan Service, Executive Director of the Arizona Housing Coalition. Joan, how are you?
Hi, thanks for having me.
Thank you for being here. Sherry Boucher, the affordable housing advocate for the city of Phoenix. Sherry, how are you?
Good. Thank you for having me.
And one of my partners in crime, CJ Eisenbarth Hager. She is the Director of Healthy Community Policies at Vitalyst Health Foundation. How are you doing?
I'm all right, John. How are you?
I'm hanging in there. All right, let's start at the beginning. CJ, what the heck does housing have to do with health?
For me, sometimes it's so obvious, it's hard to almost talk about it because I think of housing and health as synonymous. But I think there's sort of three levels that make a lot of sense when you're thinking about the connection. The first one is the most basic. It's the basic shelter, making sure that you're not exposed to the elements, that you have a safe place that you can go home, rest your head at the end of the day. The second level would be really on the affordability side. So recognizing that for many people, housing is one of the most expensive items in their budget, making sure that it's not so expensive that it requires trade-offs for things like healthy food or going to the doctor when you need the doctor, making sure that it's affordable in relationship to your overall budget. And then the last way housing impacts your health is really locational. So where your house sits in relation to all of the other amenities within your community is truly important. So let's say you have a house, you eat well at home, you go to your preventative doctor visits, but your house is right next to the highway, it has no sidewalks, and there are no good schools in the area. So you're going to get pollution coming off of the highway. You're not going to feel comfortable letting your kids go outside and walk and bike around their neighborhood. And then also the education quality is suffering for your kids. So where your house matters and the relationship it has to those other things that help create healthy people and healthy places matters as a result.
Sherry, when you're part of a thousands of employees, very, very large city, fifth largest city in the country, does that perspective play out within the halls of City Hall? Because honestly, things like zoning and permitting, I mean, that's what cities do. So how do cities come to adopt a perspective like CJ just talked about?
That's a great point. Yes. We came up with the Affordable Housing Initiative as a result of Mayor Gallego. Her State of the City address identified housing as one of the primary concerns. So we were able to start the Affordable Housing Initiative and to look within the city and what the city can do to help that.
Joan, you don't really have a perspective on housing, right? It's not something you delve
no
into.
biggie.
No.
Potato, potato.
It's not just a city of Phoenix thing where we're talking about this type of well-being. It's statewide.
Yes.
Are the challenges different in different places?
Yeah, it is different in different places, but the crux is that you want to have that cornerstone, that baseline foundational support, and that affects everybody. And so that's not just a Arizona thing, that's a nationwide thing, that's a universal thing.
Sherry, the city of Phoenix actually has a fabulous infographic that talks about what the state of housing is in the city of Phoenix. Can you walk us through some of the key points from that and introduce us to some key concepts, for example, like housing cost burden?
Perfect. Yes. I can't take credit for the infographic. It was Valerie Mitchell. So I'd like to put her name out there because she's very talented graphic design with our department. As a part of the Affordable Housing Initiative, we wanted to take a look at our need in our community and create a gap analysis, because a lot of the information you find, that you can find information about the state as a whole, you can find information about the metro area, but nothing that really hones into the city of Phoenix and our concerns there. So we did an analysis and found first that 46% of our population is extremely low income, very low income, or low income. And generally, if they're trying to find housing on the market today, they would need some form of subsidy within the city of Phoenix to be able to afford housing. So generally speaking, affordable housing is defined as 30% of your income going towards your monthly housing costs. And if you're over that 30%, you're considered cost burdened by your housing. Some overview of those terms, but that generally that extremely low, very low, and low would need some form of subsidy to be able to have affordable housing within that 30% bracket is very minimal, and there's not a lot of resources out there for them. And then there's the low to moderate, which is seen as our workforce housing range, and we have about 19% within the city of Phoenix that are considered workforce, and they still in some areas of Phoenix would need some form of subsidy. Specifically, if they're trying to buy a home, they would need a significant amount of subsidy to afford home ownership in the market. And then the remaining 35% would be able to find affordable housing pretty readily in our market today.
Okay, so this same infographic, which we will link to in the show notes, if that's okay with you,
You bet.
says that there are 555,000 units of housing in the city of Phoenix.
There are 555,000 households. So that's, yes.
Thank
so
you.
it's-
Good clarification.
Yes, you bet.
All right. Number of households cost burdened is,
199,000.
which is about 36%, which is shocking.
Very shocking.
And then, just to throw a little icing on the cake, you found that you need another 163 units
Yes.
just to house the folks that, I mean, and this goes to something that people tend to point to all the time when we talk about housing, which is people experiencing homelessness. So 163,000 units needed, plus almost 200,000 Phoenicians are cost burdened.
You bet. You bet.
Ding, 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 ding.
And
CJ, how do we wrap our heads around that? And where do we go once you start to think about those numbers?
I think a lot of attention needs to be paid to folks who are experiencing homelessness. That human suffering element is tragic. What I think some of the things that Sherry brought up are really important is there's a lot of squeezing of other households that's completely invisible. But because their housing is not affordable in relative terms to their income, they're having to make some tough choices. Again, it may be healthy food, it may be where you live, it may be the quality. You're living in substandard housing because that's more affordable to you. What I like about this is it starts to uncover some of the more invisible health and housing relationships that lots of Phoenicians are dealing with right now.
Joan, you have been a leader in this space and advocating for folks for good, affordable housing for a long, long time. Much worse now than it ever has been.
Yes.
Getting worse because of COVID-19.
Yes. Unfortunately, for far too long, an individual's income was not keeping up with the increase in rent. We see this play out with more folks experiencing homelessness. Now you add the layer of a pandemic health crisis, that's only exacerbating this connection. The housing and healthcare is so much more defined as it relates to this pandemic. We need to have that safe, stable environment so that we can self-quarantine, so that we can get better. And for folks who are experiencing homelessness, it's impossible.
In the very near term, is relief coming? Are we getting federal dollars? Are we seeing landlords practicing and following the no eviction rule? What's happening really?
We are seeing federal dollars come. We are seeing state dollars come, and we're seeing the philanthropic community. All of this is coming to the table, and it's going to be braided and blended in an appropriate fashion. It does take time. And unfortunately, people are experiencing this crisis now. The eviction moratorium is a patchwork, both at the federal and state level. It does not have all the necessary items in place to prevent evictions. And what we at the Housing Coalition are most concerned about is that when the eviction moratorium comes to an end, we're going to see renters with a huge back pay that they don't have the finances for. And the constables are going to come knocking. It's only going to exacerbate the financial crisis that our state is going to experience and the health and human suffering that folks are going to exacerbate all of their own personal networks. They're going to go knock on their friends and families and couch surf. But at some point, they'll overstay their welcome and start appearing at some of the shelters in the valley.
So if, again, you're looking at it at those three tiers, the safety of shelter, the place of shelter being so important for health. If you are experiencing homelessness or on the verge of needing to have repairs to your house and you lose your job because of COVID-19, that's impacted the affordability layer. If you're laid off from your job, that of course is impacted. But then also if you're in a community that's isolated and isn't connected to things that help you and your family be healthy, you're impacted as well through COVID-19. There are some, for example, there are some school districts that are doing a fabulous job of getting out food to their students who rely on that 2 times a day for healthy food. If you don't have the luxury of living in one of those districts and your kids relied on that for healthy food, that matters as a result.
By the way, we're kind of talking about this logistically, like, oh, well, you can couch surf for a little while or these kinds of things. We actually are not going quite to that level of, well, even if you're couch surfing, you are at a level of stress, right? You are living out of a bag. You are constantly under threat of where the next dollar is coming from and how you're going to be able to get to the next situation. That in and of itself has a tremendous impact on people's health and well-being. Their capacity to show up for work or for school, for a child to come to a school ready to learn, or a schooling situation, because they're probably not coming to school anytime soon.
You can also see those mental health stressors on each of those levels. If your house is substandard, you have lead paint, if you have rodent infestations, that's exceptionally stressful. If you can't afford the place that you're in, that's exceptionally stressful. If you don't feel safe in the neighborhood or connected to resources, that's another level of mental stress.
All this groundwork laid, and even before COVID-19 hit, Sherry, things are starting to happen. Like you said, the mayor brought it to the fore in her state of the city. So what has been happening up until COVID-19 and what is happening now during COVID-19?
As a part of the Affordable Housing Initiative, we've done extensive research on what types of policies we can adopt as a city to help out with the affordable housing concerns. And moving forward with those, we will be going to our subcommittee this week, actually Wednesday, to present those potential policy initiatives. And then in June to council to present the policy initiatives and see if the city would like to adopt some of those items to try to help combat some of the barriers we have to affordable housing.
What do those options look like right now?
There's some heavy hitters. I mean, one, we all know not in my backyard sentiment, NIMBYism is a big barrier for a lot of housing. And we found with the 163,000, there's also a need for market rate housing. So what's happening is people are not matched up with the housing that's suited for their income.
Market rate looks like what?
It depends on the location, but in Phoenix, it generally ranges from 900 to 12 to sometimes as high as 15 if you're in a prime area.
So market rate is
pretty much what you can afford.
Yes.
If you're working a full-time job above minimum wage, I would say that's market rate.
Anybody above.
Versus what other levels?
Workforce is you're working full-time at minimum wage, and even then you're working more than 40 hours.
Below that, we still have other layers.
Extremely low income.
They are, CJ?
One category is permanent supportive housing. So recognizing that some folks who are coming out of homelessness or are recovering, need some other supportive services while they reintegrate into the community. That's another category as well.
Sorry, Sherry, we're trying to, get all the landscape down. Please continue.
So one thing we would like to adopt is a scoring criteria. So as new housing projects come before decision makers, they can look at the merits of the project, the opportunities that project would bring to our community, rather than weighing the NIMBY sentiment over the fact that that housing project would benefit the community. Coming up with an objective approach to weighing these decisions rather than a personal approach that could prevent housing from happening. Anything to streamline the housing process on the market rate side as well as the affordable housing side or the subsidized housing side. Another thing that we can really impact is our zoning. So we have, as a city, we have more impactful guidance through our zoning process. A lot of cities that are in the same situation we're in have adopted accessory dwelling unit policies. It's a great way to add more density to single family housing. It creates multi-generational housing options. It creates a way for people to make income through renting their unit out. It just creates more housing units. So any ways we can look outside of the box and create more housing because we have such a need for more units, we have to think about. Another item is on the multifamily side, looking at affordable housing developer incentives. So density bonuses, parking reductions, setback reductions, anything that could create more use of the land for affordable housing developers or for market rate developers who want to pay into an affordable housing fund so we can raise money that's not federal, because a lot of federal dollars, they're wonderful. We have great programs with our federal funding. There's just not enough to go around, and there's a lot of restrictions tied to that money.
True or false, Joan? Developers are just chomping at the bit to do more affordable housing. The only thing that's holding them back is zoning.
Oh, I wish that was true.
So what is holding people back from doing this work?
I often say that, well, actually, I think I stole it from somebody, but affordable housing, getting into that, it's a HUD ache. There is so much, right? No, the reality is getting into the affordable housing development, it's very costly. It's mind numbing. There's lots of regulations, lots of restrictions, and you have to make the different layers of funding match to pencil out a project. Then you add in the political realm, the government realm of buy-in from the community and buy-in from the local leaders. In the state of Arizona, we do not allow for what's called inclusionary zoning. That's been prohibited at the state level. As Sherry mentioned, there is ways around that by incentivizing developers to take on projects because it makes those deals work. So we see that in the city of Phoenix. We've seen it play out in other municipalities in our state. For example, Flagstaff is the most costly place in the state of Arizona to live. So the city of Flagstaff was actually going to take up a housing ballot initiative pre-COVID-19. Now everything's off the table, yet the housing unaffordability is still on the table. We need to have the support of our local leaders and the business community kind of understanding that there needs to be financial incentives to play in the sandbox.
If you were to look forward in terms of this being a long-range pandemic that's going to be with us for quite some time, if you were to look forward along that landscape and then you think about something like the city of Flagstaff tabling this work, how does that make you feel and what would you do if you were in charge?
It's frustrating, but I also think a lot of local leaders have strapped financial coffers. Their budgets are strapped. So we need to look at the federal government. And I hate to keep saying look up to the federal government, but look to the federal government to say what kind of bold initiatives are we going to institute to address this housing and healthcare crisis. To me, I think of things like how can we make the housing choice voucher and the rental assistance more of an entitlement program like food stamps. Whereas right now, only 1 in 4 renters can actually get that government assistance. So how can we make it more mainstream? But it's going to come at a costly financial picture. But what can we do to address that? So I don't know if a lot of realtors are necessarily happy with this idea, but I think all of us sitting in this room, you're going to be on some level of government assistance because of the mortgage interest deduction, right? So if we repeal that, that actually goes a long way towards making the housing choice voucher a much more expanded program. But as Sherry mentioned, we don't have enough units. So we have what's called the Federal Low-Income Housing Tax Credit Program. which dates back to 87 President Reagan. It's been reauthorized by President Clinton and President Trump. So it's, bipartisan agreement to create more affordable housing. And it's been one of the best federal programs to have that public-private partnership to create these affordable housing developments. We need to strengthen that credit, especially right now in this pandemic environment where we look at the past to think about what is going to happen in the future. Great Depression, you needed to have some kind of federal program to reinvigorate the community. Why can't we look at reinvigorating a post-COVID world with more affordable housing development?
Can't argue with that.
Yep.
CJ, from a philanthropy perspective, what's going on in housing? It seems like there's been a lot of talk. It seems like there have been some things like the Arizona Housing Fund, for example. Can you talk a little bit about some of the responses that philanthropy or even the business community have been engaged in right now?
I think historically, philanthropy has been scared of touching housing and housing production because it is so exceptionally expensive. Entire foundations can spend down their endowment and not have any impact on the overall affordability of a community. So I think historically, philanthropy just has not stepped up. That said, I think recently there's been some really great movement toward philanthropy trying to figure out a place that's valuable. And I think at least for us at Vitalyst, it's been, so where are some of the cracks in the current system? And I think we're seeing a few of them. I think one of them is, as we said earlier, the less your income, the more difficult it is to find an affordable unit to your budget, and the more difficult it is for developers to build a unit that's affordable for you. I think one area is continuing to focus on that exceptionally, extremely low income level. I think the other area is on the permanent supportive housing. So again, while the structure itself is exceptionally important for people's health and well-being, what surrounds them, including services, helps their overall health and well-being as well. Here in Arizona, I think there's been some really wonderful steps to figure out different ways for philanthropy and the business community to support housing affordability. One is the Arizona Housing Fund, which is housed at the Arizona Community Foundation. And this is being financed through donations during a real estate transaction. So if we were to close on a house today, part of that closing process, you would get an option to, would you like to donate $25 to creating healthy, affordable places for people to live? So that's being developed. Last time I heard, it had well over $250,000 in it, which is just wonderful. And that's not government money at all. This is all the good places of our hearts coming through and trying to figure out how to build more affordable housing. The other area that I think is really exciting to follow is how access or Medicaid here in the state is really seeing housing as an important part of creating and keeping people that are healthy. So access in and of itself is making some moves to further its understanding and its embeddedness into housing affordability, but then also the insurers who are managed care organizations. Those insurers are really looking to see what they can do to support housing affordability for their clients. Again, they see the impact in their bottom line and they're making steps to really get into the game and support housing affordability.
Right. This is the most compelling evidence on the connection between health and housing, more accurately, healthcare and housing, where managed care organizations are learning to house people because it dramatically reduces their medical costs.
Yeah, there's one example in Maryvale that United Healthcare and Chicanos por la Causa instituted a few years ago. It's really a national model, and folks from all over the country are watching that. Chicanos por la Causa purchased and rehabbed some apartment units, and United Healthcare, overly simply put, they provided some very low-cost financing for the rehab and acquisition. So that's just an amazing role for healthcare to take, to be the financer of these units, which is just really amazing.
Talk a little bit, too, about some of the partnerships that have happened sort of in this cross-collaborative space of federal funding, city partnership, philanthropy partnership, for example, Choice Neighborhoods.
Choice Neighborhoods is a federal program that really is looking to revitalize old public housing units. So the city of Phoenix a few years ago received a Choice Neighborhood planning grant to look at 3 properties in the Edison East Lake neighborhoods of Phoenix. They went through a year-long planning process. And as part of that, one of the elements that they looked at was how could housing redevelopment increase the health and well-being of the residents. After they finished that planning process, they went back and submitted a grant proposal for $30 million for an implementation grant. So they received that, and they're in the process of building new public housing units, also attracting private market to build market rate housing units as well. Also, they're moving from solely rental, and they're trying to encourage home ownership opportunities to help really diversify the income spectrum of who lives in that particular area. It's a long process. Nothing in housing happens quickly. So this is like a 7-year process. So it's slow, but the benefit is that, it's going to be slow changes. Residents who currently live there are given the option to move to a different unit in the same neighborhood and live while there's construction, and then move back to a new unit if they choose to.
Sherry, nothing happens quickly, but coming up quickly is a city council meeting to discuss the Affordable Housing Initiative.
You bet.
As you said, there's a lot of things in this. There's a lot of suggested policy changes. From your position, the partnerships you've had with folks around the city, the partnerships you've had with different partners throughout this area, if you had that magic wand at that city council meeting, where would the most focus be, and where would the early wins come?
There are a couple early wins. One is to create that scoring criteria that would help projects move forward. There are a couple quick wins. The Community Land Trust program we're hoping to create for the city of Phoenix. It's a way to reduce the cost of home ownership by the cost of the land. Not only that, but those houses remain affordable as you buy and sell. You sell to another affordable household.
How does the Community Land Trust work?
So the house is placed into a community land trust and owned by the community land trust, and then sold to a low-income buyer, but only the improvements upon the land. The land itself is leased maybe $1 per year, very low rate, so that the cost of the property is actually significantly lower than it would because the land is not included.
Who governs the Community Land Trust?
We would aim to work with an established community land trust. Right now, the primary established community land trust is Newtown, and they work all over the valley, and they have a pretty active program. But it's a great way to invest into your community and to preserve affordable housing for home ownership. So that would be a quick win as well. There's other ways that you can reduce the cost of development by streamlining the process on the pre-development side. And a quick win could be for us to assign a planner in the planning development department. That could help streamline the permitting process, which we hear can be a little bit cumbersome.
What?
And can be potentially costly if there's a lot of back and forth. So having somebody who's familiar with the low-income housing tax credit program and the very complex deal structures that these affordable housing projects have, and the limited budgets. So maybe not a lot of room to do a lot of fancy improvements that might be required during that planning and permitting process. So having that understanding could help streamline. That could be a quick win as well. Another thing that I would be excited about is taking a look at the city-owned parcels and how we can redevelop that land. The housing department is already looking at that. We have identified 4 different parcels and piloting one right now. So hoping to also expand that throughout the city with other city-owned parcels. So that would take a lot of buy-in. It would take us to look at the parcels, identify the ones that are in opportune areas next to healthcare, next to education, next to food, next to all the things that make a community a vital place to live. And then put those RFPs out to redevelop a housing component or mixed income housing. It could be affordable and workforce, or affordable and market.
Joan, are you smiling at what Sherry's saying because you're excited about it, or because you aren't sure it could happen in this day and age?
Oh, I think it absolutely can happen. We have some great leaders at the city of Phoenix. The city of Tempe also has some great leaders instituting some similar affordable housing initiatives. That's great. We need that political will to make this happen. So I'm shaking my head with excitement.
A new set of partners that have really come up is real estate developers. So Urban Land Institute, Arizona, has received a grant to focus on health, housing, and equity. And so these are private developers who are understanding the importance of having a range of housing affordability and the impacts on health. And that's important. So I see the real estate community really hopefully continuing to step up and be supportive of these things. I know they're frustrated by NIMBY too. So I think, While that's a difficult conversation to have, and I don't know if there's any place in the country that's had it well, it's a conversation that needs to be had regardless.
I'm just really excited about the fact that we're seeing all these different levels of government, federal, state, and local, the business community, the philanthropic community, they're all coming together to address the issue of affordable housing because there's clear impacts. There's a financial impact. As an employer, you want to make sure that you attract employees that want to live in this community. And the only way you can do that is if you have affordable housing for all layers of employees and, all levels of professions.
Yeah, if I'm not mistaken, that's pretty much how the city of Phoenix got into this way back when was
Right.
like, wow, our employees can't even afford to live within reach of City Hall.
Right.
Yeah. Joan, poof, you're a developer. Why is it important to do the things that Sherry talked about in terms of speeding up pre-development and helping to simplify the stack of financing that goes into making a housing project pencil out?
Because as an affordable housing developer, whether I'm a nonprofit or a mission-driven for-profit entity, I am trying to create affordable housing so that all walks of individuals can have that stable environment to live and grow and prosper. And so to do that, I am subject to many different regulations, and I want to streamline this process to make the development faster, more cost-effective.
Predictable.
Yep.
But you're in a hurry for another reason, right?
The reason why we would want to move fast is because we want to make sure it's cost-effective, affordable, equitable, meeting the needs of the community and the environment, the employees, the individual. And as a developer, I've got money on the line. It's impacts my bottom line.
Literally sunk into the deal already, and you're
Absolutely.
waiting for somebody to approve it, right?
Absolutely.
The Arizona Community Foundation is celebrating its 10th year of a pre-development loan fund because that is so hard for especially nonprofit organizations. Pre-development can be very, very costly, and there's no for sure win at the end. So ACF has this pre-development loan fund over 10 years. They have had some really wonderful successes with it.
And thinking about the bigger picture, if all of the projects are using less money, they need less gap, they need less low-income housing tax credits, we can create more units with less. So
Yep.
that would be really great to do because we have such limited resources.
You're really thinking about doing things efficiently? Stop it. All right, so we've talked about the things you would do that could be easy, quick wins. Let's talk about some of the other things that are in this proposed initiative that might be a little more controversial, that might have a few more barriers that they're facing and why they're important and what those barriers are.
Another quick win I didn't really mention is our education campaigns. So that might be controversial as we get out into the community and start telling the story and communicating the need and getting people to think outside of the traditional single family development method because there's such a need for housing. We don't have enough vacant land in the city of Phoenix to build within all of those vacant acres the number of housing units we need. So we would have to think in a different way, creating single family options, but townhomes or in a more dense fashion. We're not going to put a 5-story high rise in a single family zone, but really thinking outside of the traditional way that Arizona develops so that we can create enough housing where it needs to be. And that would be part of debunking some of those myths. It's something that Minneapolis has done as they've ruled out their single family zoning. They still allow for single family homes, but you have to build in a more dense fashion. So that could be a really great way for us to tell that story outside of the box.
CJ, you've been involved in affordable housing all over the country. When Sherry said 5-story high rise, did you giggle a little bit?
I know. That's high rise for us.
Yeah, that's right. Exactly. There was an article that came out a few years ago that talked about density because people in general freak out about density in most places. Phoenix, definitely. Places that have a lot of land available. You talk about something over 3 stories high and people start to perspire. And someone was saying, what the density that we're actually looking for in most places is something that you would find in Paris. Draw to mind what you think of Paris and walking down the street and all the beautiful things there and how walkable it is and, lovely and so forth. And at most, those are 5 stories tall. I would say more along the line of 3 or 4 stories. So when we're talking about density, we're not suddenly building 90-story buildings all over the place. We're just adding on a few floors beyond what is typical. And I think a distinction needs to be made about what Sherry was talking about early and later in the conversation. The first part was, what are you excited about? And she listed some really wonderful things, including talking about NIMBYism, developing a scorecard for housing development, and then also dealing with city-owned properties. Those are all gigantic lifts. While those are preferred, and I love those, and those would be my favorite too, those are not going to happen overnight, unfortunately. They're going to be tough. I think those are the more promising ones of all of them. Even the easy, and air quotes, easy ones are going to be really, really tough.
Sherry kept looking at me when she was talking about the NIMBYism because the Housing Coalition is eager and anxious to support our members in combating NIMBYism because that is a significant barrier. And we would like to kind of take the hard work that the city of Phoenix is doing and kind of broaden it to the rest of the state, but also kind of make it geographic specific because obviously the face of affordable housing in the city of Phoenix looks a lot different than the face of affordable housing in Mojave County or in Page, Arizona. But yet the NIMBYism barrier exists in all of those communities. So how can we create a more palatable picture?
Now, CJ said it, and it's obviously true. Nothing happens overnight in
It
housing.
happens overnight.
And yet, what is going to be happening overnight in housing is people are going to be losing their housing.
Correct.
I mean, there's no question. I understand actually for the month of March, a fairly high percentage of people actually were able to make their rent payments.
March, April, and May, yes.
March, April, and May.
Mm-hmm.
But this cannot persist.
No.
While there's a whole bunch of policy change that needs to happen, and it seems like that will happen slowly, does that give you a great deal of hesitancy about the gap between what's going to happen in real time, probably over the summer, where a whole lot of people are going to lose their capacity to actually maintain a household?
That gives me anxiety that when the eviction moratorium comes up, people who haven't been paying rent because of being impacted by COVID-19, they're going to have this back pay. And the pandemic unemployment insurance and any kind of COVID stimulus isn't going to be enough.
Back to what Sherry was just talking about an education program. Let's start now.
Right.
In terms of the people who are listening right now to this podcast, how would you like to educate them about what's important?
Honestly, what we're trying to focus on is strengthening the communication and education. And it's both communication and education between tenants and landlords. So tenants are experiencing this housing crisis. And sometimes when you're in a crisis, you're crippled. You don't know what to do. You don't know who to turn to and what programs to apply for. But landlords, they're in this business of providing this service and getting paid for it. They aren't as significant of a crisis. Why can't those landlords walk alongside the tenants? Because they are educated on what programs and help that tenant apply for the programs so that they get paid. It seems like a win-win, but yet there's a little bit of a disconnect. So we need to strengthen the education and communication between those two parties.
Oftentimes in talking about having difficulty paying your rent, it's automatically seen as an adversarial relationship.
Mm-hmm.
And this is just looking at it more like, okay, this is a conduit. Here's an entity, the landlord, who deals with lots and lots of tenants, having a source of information that they can give out when necessary to folks makes a lot of sense.
If you had to guess, and I know this is an unfair question, but Joan, if you had to guess, what percentage of landlords are willing to do that kind of work versus those that think it's purely a transaction, where would you put that percentage?
I'm going to say this. There's some unharmful players in both the landlord party and the tenant party, right? There's some scrupulous players in both of those. I think ultimately it is a business transaction. So the landlord, it behooves them to be well educated and to walk alongside and support that tenant. But the reality is most of the time tenants are in crisis and they can't think about what the next step is and then try and figure out where their social security card is and let me pull down my APS bill and where do I get my paycheck from my employer who just fired me and I'm frustrated and I'm hurt by.
Part of the reason we're in the place that we are with affordable housing has to do with the way our state legislature has chosen to fund or not fund work in housing statewide. Correct?
Correct.
What is the state legislature doing now that we're in a crisis, or what should they be doing that they're not?
I think right now they're assessing the situation and ultimately I think they're going to adjourn but then look at a special session to look at the COVID-19 fallout, which for folks experiencing homelessness must be addressed. It must be addressed. Now, we have two policy interventions that we think can go a long way. The policy solution that should have been implemented before the COVID-19 pandemic, and just again further illustrates the efficacy of these two interventions. And that's the State Housing Trust Fund, funded by unclaimed property proceeds, and is exceptionally nimble and responsive to community needs. So, as an example, when the pandemic hit, Governor Ducey and the Arizona Department of Housing used $5 million from that Housing Trust Fund to fund the COVID-19 eviction prevention program. Anybody who can't make their rent because of COVID-19 impacts can pull down some financial resources from that. Gosh, wouldn't it have been great if we'd restored that Housing Trust Fund to better bolster that program? That would have been amazing. But I think that that's, again, a solution that legislators can be looking at going into the future. Additionally, we were advocating for enacting a state low-income housing tax credit, which mirrors the federal low-income housing tax credit and bolsters that program and is one more tool in the toolbox to, again, incentivize developers to come to the table to get into this mind-numbing work, but so necessary work.
Do other states have that at the state level?
Yes, about 22 different states. In fact, South Carolina, I believe it was, passed a state low-income housing tax credit in the midst of this COVID-19 pandemic. So they understood the importance of looking beyond the triage of assessing what's happening, but also thinking about the future and saying, okay, we need to bring more units online to really meet the needs of folks who are housing burdened. So we need to institute the state low-income housing tax credit.
I think it's important to recognize that there is a very important role for state government to play in financing housing. It will not happen without government support, either federal and state. And so most other states, I would dare to say, have state appropriated funding mechanisms to support the development and rehab of housing that's affordable. And so this role of both the low-income housing tax credit, the state version that Joan was just talking about, and the Housing Trust Fund, those are very appropriate and very normal strategies for states to take in supplying and supporting housing affordability.
All right, if you had that lovely magic wand and you could make something happen within the next 30 to 60 days to improve affordable housing in Arizona, what would you do with that wand? I'm going to start with CJ.
I think the first two are just no-brainers. Restoring the Arizona Housing Trust Fund to the original formula. I think that's just a no-brainer. Second one, again, no-brainer, is the state low-income housing tax credit, establishing that. There's great momentum on both sides on this past legislature. Let's just get it done. I think the third one that I would be most interested in seeing, and I think would have the most impact, is a discussion about use of city-owned property to help that deal with some of the real costs that are associated with developing affordable housing. So when Sherry was talking about what are the properties that the city owns and how can we get those on market and get them built with housing that's affordable to a range of folks, I would love that to happen. That's been a discussion point for years and years and years. The city of Phoenix is not alone in talking about it for years and years and years, and there has not been a lot of steps for many reasons. I would love for there to be some movement on that.
Sherry, same question to you.
When you're talking about affordable housing, one of the needs we have is to fill the gap. So how do we fill the gap? The gap between the cost of constructing housing and operating it to a lower income bracket. We do that very successfully with the low-income housing tax credit project, but it's not enough. It's not enough to build the number of units that we need. So we need a significant amount of funding to be able to increase the production of housing. As CJ mentioned and as Joan mentioned, the state low-income housing tax credit program would really help with that. And also a state housing trust fund would also help with that. So the Affordable Housing Trust Fund. But there's other funding mechanisms, finding new low interest financing sources for developers. That could even be from the lending institutions that already exist. So identifying their risks and figuring out how we can mitigate those risks to make more low income financing options for these developers. That might spur some more workforce housing, get more housing out there, even for the medium income ranges. So really looking at different ways to increase our funding all around would be my magic wand.
All right, Joan, we're 2 out of 3. What are you going to play?
Actually, I had 3 wishes, and CJ covered one of them. Number 2 is getting the City of Phoenix Affordable Housing Initiative passed so that we can highlight that across the state and across the nation. We often look at other communities as, we should model them. No, we have it right here in Arizona. We're doing good stuff. Let's make this happen. Let's showcase that. The third is to pass a CARES 2.0 that better addresses some housing provisions.
What does CARES 2.0 look like to you?
It creates emergency rental assistance. It strengthens the low-income housing tax credit, that it also infuses funding to the housing counselor sector, which they were so instrumental during the housing crisis in 2008, 2010. They are going to walk alongside individuals and families and kind of dig them out of this economic fallout.
I think that's so important. I mean, I really love that you brought up housing counseling in the Great Recession. It played a huge role in helping people retain housing or stay in their situation or get out of it as wholly as possible from a financial standpoint. Then it was a lot of homeowners. Now probably we'll see some homeowners who've been impacted, but then also a lot of renters. So having a robust, well-funded housing counseling system is super important at this particular time.
Great point. Again, the Great Recession is our last model for how badly things can fall through the floor during a crisis. We don't yet know the exact extent of COVID-19 and what it's going to do. It'll probably be worse. Based on everyone having lived through that experience, what were the key things that were done well in that response that should be done more this time? And what were the things that actually didn't work out so great?
I think one of the things that they did at the federal level was they got out housing counseling funding exceptionally quickly. So they got it out to nonprofit organizations within a 60-day time period. It's that kind of immediate response that's needed. That's often very difficult when you come to the federal government. So I think doing the same, getting money out to nonprofit organizations very quickly who are already doing financial counseling right now would be important.
Joan, question to you.
The federal government responded with the American Recovery and Reinvestment Act. And with that funding invested in local nonprofits, a proven best practice came out of that, and that's rapid rehousing. Basically taking an individual or a family and rapidly putting them into housing with some short-term financial resources and case management. That proved to be a best practice that we're still implementing today. The funding dwindled away. But again, this just is illustrative of how nimble and responsive and progressive our sector is.
Sherry, you're the City of Phoenix's affordable housing advocate. Has your phone stopped ringing over the last 8 weeks?
No, it hasn't.
What are you hearing from people who contact you?
The problems are just going to get worse with COVID because the people who are impacted are people who are in the lower wage brackets. They have less flexibility and they're more cost burdened. So they're more susceptible to being pushed into experiencing homelessness. They're the most vulnerable populations that are being affected by COVID. It's a big struggle.
Now, in some ways, obviously cities are just as stretched as anybody else, right? There's no revenue. To this point, I don't believe there's any federal relief that has gone directly to cities to provide additional help.
I have heard there is money coming through.
There is. Okay.
Yes.
Here is.
Yeah.
So what resources do you have to pull on when people call you?
Right now, they haven't been rolled out yet, but we have received federal funding through the CARES Act. We received additional CDBG funding. Community Development Block Grant funding, and additional housing for persons with HIV and AIDS or HAPA funding, and ESG, which is Emergency Solutions. All of those items together, we're cooking up some great opportunities to try to serve the most vulnerable populations and create new housing ideas for different populations. As we all mentioned, they're federal dollars still. They're slow moving. Some of the programs we can roll out a bit quicker, but some of the larger projects they're looking at, like adapting a hotel into permanent supportive housing for people experiencing homeless, that will take time. There is funding out there.
Joan, how many Sherrys are there across the state?
Oh, well, she's amazing. So I'm just going to highlight her.
No.
But no, we do have, I just got to say that, like, yes, things take time. Housing doesn't happen overnight. But as an industry, the affordable housing and ending homelessness sector, gosh, we're such a nimble and flexible. I mean, I think we're no better suited to deal with this crisis than this industry with people like Sherry and CJ and you, John. We're innovative and collaborative and nimble and responsive. And so we're going to pull every string we can to figure out the way to get the work done, to get people housed, and to make a better community.
Thank you, Joan. Thank you, CJ. And thank you, Sherry. The three of you are not only powerful and compelling advocates, you are also thoughtful, nimble, collaborative, and innovative forces for positive change in Arizona, amidst the unknowns, the demands, and the challenges of COVID-19. Speaking of which, our COVID-19 roundtable will be back next week. Without a doubt, there will once again be a lot to digest and analyze as states including Arizona move forward with reopening and continue to make strides to increase testing. In the meantime, don't hesitate to delve into our back catalog of episodes. There is so much to explore related to community health and well-being, including guests from across the state and national experts too. Visit us on the web at vitalysthealth.org/podcast. Check out all of our current and past episodes on Spotify, or simply reach into that podcast app you're using right now and select another show to find out what's going on related to health and well-being in Arizona. That's it for this episode. The takeaways from this dialogue belong at the family dinner table as much as they do in your place of business, in city and town halls, and in the domains of healthcare and public health. So please share this episode far and wide. Subscribe to the Vitalyst Spark podcast to get notified as soon as new episodes are released. And like we mentioned above, we've got great news on that front. The Vitalyst Spark is now also available on Spotify, and you can subscribe to be notified of new episodes there too. In the world of podcasts, you can give us your feedback on Apple Podcasts, Google Podcasts, Stitcher, Overdrive, or wherever you get your podcasts. You can also give us your input the old-fashioned way. Your corrections, complaints, and compliments are all welcomed by emailing us at feedback@vitalysthealth.org. Finally, remember this. With great responsibility comes great power. We'll see you back on the road to well-being soon.